A world with daily mental health checks. If every person had to take a mandatory mental health check daily, society would experience profound changes. Early detection of stress, anxiety, and depression could improve overall well-being, but it might also raise concerns about privacy, employment, and government control. Improved early detection and treatment. Mandatory checks could help identify mental health issues before they become severe. With daily monitoring, individuals could receive timely support, reducing hospitalizations and suicides. Therapy and counseling services would become more accessible and widely accepted. The role of AI in technology. AI-driven mental health assessments could analyze emotions through voice, facial expressions, or biometrics. While this could lead to better self-awareness, reliance on technology might depersonalize care, making treatment feel robotic rather than human-centered. Workplace and productivity changes. Employers could use mental health data to adjust workloads, preventing burnout. However, there's a risk that companies might discriminate against employees based on their mental health scores, potentially leading to job insecurity for those struggling with stress or anxiety. Privacy concerns and ethical questions. Mandatory checks would raise major privacy concerns. Would governments or corporations have access to this data? If so, how would it be used? The possibility of surveillance or forced treatment could create ethical dilemmas about personal freedom. Impact on social stigma and awareness. Regular mental health checks could normalize discussions around mental health, reducing stigma. People might become more comfortable seeking help, leading to a society that values emotional well-being as much as physical health. Effects on schools and education. Schools could monitor students' mental well-being, allowing teachers to intervene before issues escalate. While this could create a healthier learning environment, it might also lead to unnecessary interventions or pressure on students to always appear mentally stable. Legal and insurance implications. Health insurance policies might change, with premiums based on mental health scores. Courts might use mental health data in legal cases, raising questions about personal responsibility and whether someone can be held accountable for their actions during a mental health crisis. Would everyone comply? Some people might resist daily assessments, seeing them as intrusive. Governments or employers could enforce participation by linking compliance to benefits, salaries, or access to public services, creating a potential divide between those who comply and those who refuse. Would society truly benefit? While daily mental health checks could improve lives, the balance between care and control would be crucial. If implemented ethically, they could revolutionize well-being. If misused, they could create a dystopian society where emotions are constantly monitored and regulated.